typical flu season in the US occurs, it's usually somewhere between November and February. I think that's going to be a big challenge if we do have both of these viruses circulating, because it is very hard to tell them apart. Technically, the flu can't turn into COVID-19, but there have been a number of reports of people that have actually been infected with both. There are a couple of symptoms some people get with COVID-19. That's the loss of taste, the loss of smell. That is something that's a little bit more indicative of COVID-19 infection. But otherwise, it's going to be really hard to tell which one you've got just based on symptoms alone. So, there have been some reports of people, at the same time having influenza and COVID-19. I think it's probably going to be relatively rare, so typically when you're infected with one virus, you have this short period of time where it's hard for another virus to infect you. But there is somewhere in that window, there probably is a little window where you can be infected, at the same time by both viruses. And that's probably something we don't want to happen. Both these viruses fortunately kill tens of thousands of Americans every year, and of course around the globe much more than that. If we look at the current mortality rates of even with a fairly severe flu season and COVID-19 overall, COVID-19 does seem to be at the moment a little bit more severe in terms of it's killing more people than we would expect from an annual flu season. So this year I think it's incredibly important for people to go out and get the flu shot, even if they've never had it before. And again, the main reason for that is we just don't know what might happen if lots of flu and lots of COVID-19 circulate at the same time. We don't know. So we've got to do it's possible that could be the worst case scenario. So we've got to do everything we can now to try and stop that from happening. So I think the suggestions are the usual advice that we get coming into a flu season. So it's the personal hygiene habits that everyone's been doing for COVID-19, the social distancing and the mask wearing that I guess people are getting really tired of. But it does seem to work really well. And if you're starting to feel sick, call your GP, your physician, and get some advice. We do have antivirals against flu, but they only work if you get it early. So if you're starting to feel sick, call your doctor. Keep washing those hands. If you're feeling sick, stay away from people, stay away from wine.